Edutainment Studios welcomes you to Health Insurance, Knowing Your Options. This module is part 1 of a 6-part series on health insurance. Health insurance can help you stay healthy by paying for all or part of the medical care you need. However, it is easy to feel overwhelmed with today's health insurance options and requirements. There are more types of health insurances to choose from than ever before. All of these choices, along with new laws created to protect you, make choosing a health insurance plan more confusing than ever. At the same time, the health insurance providers are putting more expectations on you to take greater control of your own health care. In this course, the objective is to help you state the basic information about health insurance. Medical care is expensive. Many people cannot afford to pay for their care in its entirety on their own, especially if they sustain a serious sickness or injury. Therefore, an agreement was designed with a health insurance provider, sometimes identified as a payer or insurer. The first part of the agreement is that you, as the patient, will pay a set amount to the insurance provider each month. This is referred to as a premium. The second part of the agreement is that the insurance provider, in exchange for the premium, agrees to share the cost of the medical care that you need by paying for all or part of certain services. Which services they pay for and how much of the services they pay for depends on many factors, including the type of health insurance plan that was chosen. The idea behind health insurance is having a group of people called plan members or beneficiaries who have purchased the same type of health coverage. Everyone pays the premium every month, whether they need medical care or not. Because most people are usually healthy, the premiums pay for the care of the few who need it. Ultimately, this works out for everyone, as any one of them could be the next one in need of care. There are 4 main reasons that you would need to purchase health insurance. First, it motivates you to stay healthy. By paying for all or part of your medical care, health insurance allows you to get medical services you probably could not afford otherwise. This includes preventive services, such as testing and procedures that will include high-cost, life-saving treatments for serious conditions that may arise. Second, it protects you financially in case of emergency. You cannot predict when you might get sick or hurt, even if you're young and healthy. Without health insurance, hospital bills could wipe out your savings or take years to pay off. Yes, health insurance can be expensive, but not having it could end up costing much more in the long run. Third, it saves you money on general medical care. Overall, you will pay twice as much for medical care if you do not have health insurance. This is because doctors and hospitals make agreements with health insurance providers to charge plan members lower fees for the same services. They can do this because of the large group discounts that come with dealing with a very large patient population. The larger the group of patients under the plan, the better the pricing is in contracting for services. Fourth, it is the law. According to the Affordable Care Act, sometimes called the Health Care Reform Law or Obamacare, everyone must have health insurance. With the exception of a few special cases like your income being too low, a fine can be charged for not being insured. The Affordable Care Act, or ACA, was passed to make health care more affordable and provide the means for many more Americans to acquire health insurance. Created to protect you, this law allows you to have more control over your health care, with more choices in health insurance. There were some important points added in the laws that went into effect in 2014. You cannot be turned down or made to pay more for health insurance because of a pre-existing condition, which is any injury or illness sustained before signing up for an insurance plan. Unless the health insurance policy is through a very large employer, the insurance provider must pay for all or part of the 10 essential health benefits. These benefits will be discussed at a later time. Also, preventive services are free with most plans, as long as the doctor participates in the network for that specific plan. Insurance providers cannot set yearly or lifetime coverage limits. This means that the health insurance company must continue paying the amount that was agreed upon, despite the amount of medical care that may be needed. If emergency care is needed, like in the case of an injury or a heart attack, you are able to go to any hospital of your choosing. The hospital can be in or out of your plan's network, and you will not be penalized or required to pay more. Pre-certification is also not needed prior to receiving emergency treatment. Insurance providers cannot increase the premium amount by more than 10% without explaining why the increase was needed. While preventive services are usually at no additional cost to you, How much the insurance provider pays for the other essential health benefits depends on the type of plan it is, as well as a number of other factors. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for Part 1 of this 6-part series on health insurance, and come back for Part 2.